Canadians think that we can stop this at the border.
That was one of the last times the Trudeau government would insist border closures don't work. 3 days later, the flights stopped, as growing evidence proved Canada was wrong.
The time is the most important variable in this, yeah.
This researcher helped advise the Australian government to close on February 1st. Her subsequent analysis found it reduced Australia's early caseload by 86%.
We prevented, a much bigger epidemic. Just closing to China at the moment was the best things we could do.
Canada's COVID death rate is more than 50 times Australia's, but Canada has some issues Australia doesn't. Of course, Canada has a land border, and its closure is not complete. In April, more than 10,000 people a day were still crossing over. Canadians living in the U.S. would like to visit family here, but quarantine requirements make it impractical.
I haven't been able to see them in months. My grandson has learned to ride a bike. One of my granddaughters has learned to walk, and the other granddaughter has learned to crawl. And they've done all of that without me being there.
Epidemiologists say the border makes Canada vulnerable. People are still free to travel between Alaska and the lower 48, potentially threatening Canada's efforts to keep COVID out of the north. And while the curve is bending down in Canada, the U.S. is trending back up again.
Stronger efforts to, for example, test truckers. They've apparently, anecdotally, have been a group that's been relatively hard hit.
We are going to be very, very careful about when and how we start reopening international borders.
The government is still nowhere near being able to test the 6,000 people that enter Canada on an average day. In normal times, the flow of people is about 250,000 and would require far more daily tests than Canada has yet been able to carry out within its borders. That's how far Canada is from being able to reopen safely. Evan Dyer, CBC News, Chelsea, Quebec.